Welcome to Behavioral Health Today, a podcast brought to you by the Triad Network. This podcast is designed to share trending topics occurring within the world and our communities and bring them a behavioral and mental health perspective.
Welcome to Behavioral Health Today, a Triad production. I'm your host, Sharlee Dixon. Joining us today is a returning guest, Ram Krishnan. Ram is the CEO of Valant, a leading EHR software provider for behavioral health practices. With a background in healthcare information management and a track record of developing market-changing products, Ram began his career as a systems engineer and holds an MBA from the University of Chicago. Since joining Valant in 2020, Ram has guided the company through its next growth phase, prioritizing customer feedback and fostering strong teams. Under his leadership, Valant is well-positioned to enhance its service to the behavioral healthcare market. We're excited to have Ram back with us today to discuss trends in accessibility and access to mental health services. Welcome back to the show, Ram.
Thanks, Sharlee. Thanks for having me. It is great to be back. We had a lot of fun last time, so I'm looking forward to it.
Absolutely, absolutely. So I'd really like to start off today the conversation by setting a foundation on this topic. Can you give us an overview of the current landscape of mental health service accessibility?
Yeah, such a big topic, Sharlee, right? Like, I think if we just set baseline of what is happening in the world, over the last decade or so, mental health has really started to make its way to the spotlight in terms of acceptability. There's still stigma, but it's improving. So I think the state of mental health for us was really kind of brought to light through the pandemic. I know that was 4 years ago, but we're still feeling the kind of shockwaves of that, in some ways in a positive way, because it has gotten people more accepting of and willing to acknowledge mental health as part of health, not just a separate subcategory. So demand has increased over time. Demand has increased from employers. Demand is who demand coverage for their employees in some way, shape, or form, or services. So payers are at least talking about a bit more spotlight on it. Now, federal government and state governments are also talking about it. But challenging thing is supply hasn't really changed much. And the dynamics of compensation on the supply side haven't changed much. So you have growing surge of awareness and demand, not that much growing surge in supply, and not a betterment of the economic situation for supply. You know this as a practitioner, right? The rates have it. If you're taking insurance at all, I mean, I know you work in a school district, but you must have your peers and colleagues. They're not getting paid anymore for providing these services, right? So I'd say a lot of like tailwinds, if you will, and growth, unfortunately, on the demand side. Some that's fortunate, some that's unfortunate, but a lot of constraints still on the supply side.
Right. And so just like you mentioned, that the demand has increased just in the last maybe 4 or 5 years. Of course, since agree with you, since the pandemic, how do you think that mental health practices are coping with that increased level of demand? And like you mentioned, maybe not necessarily more supply, maybe not necessarily more practitioners, maybe not necessarily more money. How are practices working through this?
Yeah, it's a really challenging systems problem in multiple ways, because it's not just a function of, and it's interesting, Sharlee, like I joined Valant in 2000 in October. I've been in healthcare a long time in other parts of healthcare, and often for small businesses, which most of our market on the outpatient side are small businesses. They're not giant organizations. You're always, one of the things you do as a partner, a service partner, is you're trying to help them manage demand. And usually it's a function of trying to grow. This is one of those markets where there is so much demand. A lot of our clients are working with massive backlogs and waiting lists versus necessarily even projecting to the world that they exist and they're just trying to source demand. Then you have new practices trying to create demand. I think one of the biggest challenges, it's a multidimensional problem, because you have patient population that's calling you for a service, and these small businesses they got into the profession because they want to help people. But the fact is, an important aspect of a successful client and service provider relationship is that there's a good match, that the match is the right match from a personality standpoint, this is my diagnosis as a patient or a client, and this is my expertise as a provider. That's not really clear out there, right? When you're searching as a seeker, I'm an Indian man. Like maybe I want to talk to an Indian man who's going to get me culturally, ethnically, like understand what I went through. If I'm trying to unpack childhood trauma, right? It might have a higher likelihood of success. So I just picked that as my personal example, but you can unpack that to the many versions of that exist for every dynamic of a person. And there is a high percentage of one-time therapy rates, right? Like you do your intake, maybe you get to the first appointment after that, but there's a high drop-off rate after that. That really messes up the whole capacity planning. I think I'm full this week, but maybe a quarter of them are new patients that are going to drop out next week. And yet I have this wait list. How do I pick the right patients based on this fit to make sure that they stick with care and I'm efficiently onboarding the right type of client? That's the provider side, right? Like on that side. So it is a multi-dimensional problem. Just filling your schedule doesn't mean I'm filling it with the right type of patient. For me personally, as a provider, because I want to deliver results, and I want to treat the type of patients I'm good at treating. And if I do that, they're likely to stick with care, right? And then I want people that can pay. To be frank, they need to have coverage for the insurance that I take, or if it's a cash payment, that they understand all that process. And so there's a lot of dimensions to this. It's fairly challenging. I think that the access problem is not a solved problem. It's one that's we're trying to solve in lots of different ways.
Absolutely. And I can imagine that it is going to continue to develop and change. And I'll say, just being on both sides of that spectrum as a patient and as a practitioner, like you mentioned, trying to find the right person to see that will be able to address those needs. Maybe that does take multiple one-time visits as the patient, but then also as the practitioner, like, gosh, I've seen this one lady or I've seen that guy. So trying to, like you mentioned, trying to find the right fit in all of the different areas, I'm sure is a huge barrier for patients and as well as practitioners.
I think it's unique to mental health, right? So like you don't have the same dynamic when you go see your podiatrist, right? You don't need to have the right match. A foot is kind of a foot, and I'm using that as a simple example. It does matter, of course, but not as intimately as it does for our market. I will say this is one of since the last time I spoke to y'all, like this is one area we've tried to solve. We've built a lot of matching criteria in our software for describing. If Sharlee, you were a provider, you would say, I am great at treating depression. I want to treat this type of person, and I'm credentialed and enrolled with these 3 insurance companies. That's it, right? Like picking the simplest of criteria. Right. We build that about our providers, and then on the inbound side, when prospects put in information in a form, we allow them to ask the same things. What do you prefer? I prefer, an LGBTQ female with Blue Cross Blue Shield that can see patients on Fridays, because that's the only time I'm free. Right? Thanks. And we help build a matching score between the two, because we think that is fundamental to successful results downstream. And you can see a higher retention rate for your patients when you get the right match. And that's good for both sides.
It is. That's what I was just going to say. That sounds like the perfect, like you mentioned, the perfect match for both sides. Again, being on both sides of that issue, trying to find the right fit is the most important piece of that. It won't move forward and it won't be successful if you don't have that right fit, the right match.
Yeah. Because in your heart sometimes, that, look, I want to help everybody, but this is the kind of person, like, I just may not be a great fit for, and
Absolutely.
And you know that, right? You feel that. And
you feel it. You almost feel it as soon as you meet.
You do. It's a chemistry there. And you're trying to help facilitate that. So you're not put in that difficult position of all, because you're never going to say no once they're in, right?
Right.
Anyway, I love talking to people doing the real work.
Understood. I'm right there with you. So then, speaking of obstacles, what would you think are some obstacles preventing individuals from then accessing mental health care? So we did mention trying to find that right fit, but what else do you think is out there? What are the problems?
Yeah, look, I mean, it's multifold again, right? There are just a lot of folks that think I might need help and have zero clue where to start, right? 54% of low-income households, and of our population, have zero clue where to start. And don't even attempt to seek care because of that, right? They're likely to go to their community centers, wherever if there is one, wherever they are, to find like guidance on where to go. They might go to their church, that might be the place they go. They're not seeking professional care because they don't even know how to. Across the states, you have such a high variation. We have 7,000 plus psychiatrists in California, where I live. There's like 60 in Wyoming. And Wyoming's a pretty big geographic state. So like if you have to go like drive an hour for care, that's difficult to do, right? Like maybe 2 hours to do. So supply, like we said earlier, is a challenge. And then affordability, right? Like I saw a stat that 25% of people who are deciding whether or not to get therapy have to decide between whether they spend the money on the therapy or like food or rent. And that's because it's not well covered. 40% of psychiatrists don't take insurance. 60% of your prescribers out there are all you got to work with. Like 40% are cash only. And I think it's something like 25% on the psychologist side. And just because they take insurance, it doesn't mean they take my insurance, right? So that becomes a barrier right there. So like all these parts is financial barriers. I may go try to call you and you don't have an appointment for 9 months, right? Because by the time I figured out, to pick an illustrative example, there's 500 therapists in my town. If I find out who they are, and then I realize, okay, 20 of them are covered by my insurance, right? Like, and then 2 of them have an appointment in the next 5 months, right? Like, so it becomes multidimensional. We're all busy. You spend that 30 minutes trying to figure this all out, and then it's gone. And I know this from experience, to be frank, as a user of mental health services for my family. Like, this is my personal lived experience, and I'm in this industry, right? Like, it doesn't give me some like distinct advantage either. I'm swimming through the same seas as a user of the system.
Right. And I completely agree with you. I mean, as a practitioner, as somebody that's been a social worker for, at this point, almost 2 decades, trying to find the correct fit, the correct practitioner for myself, my family, my child, merging every piece together. Are you available? Do you accept the insurance? Are you available at this day, at this time? I want in person versus virtual. So trying to get all the pieces together can definitely be challenging. So you mentioned that low-income populations or low-income households do have specific barriers. Would you then say that there are other populations or other communities that are affected by their own set of barriers? And what do you think those unique challenges may be?
Yeah, I think the access problem, like, on the one spectrum, there's the uncovered who have to find help in their community. On the covered side, you have to find somebody who takes your coverage, right? So like as you're working your way up, that becomes really just problematic, is the density of availability. I really do think like if you take those populations, that challenge is also the ethnic or cultural stigmas in some populations still exist. So like being open about it and seeking help in certain communities is really frowned upon. I think that still exists as a challenge. Making sure your employers are supportive of mental health as an equal kind of aspect of health as the physical health. And then comorbid situations where you have like a physical challenge. If you have type 2 diabetes or a heart condition, you probably have depression as well. Like they're comorbid, right? And the continuity care required is care for both. So earlier I said some people are choosing between eating or rent and mental health care. They're also choosing between physical health and mental health, right? That's another trade-off they're making, even though they're so often tied at the hip. If I have type 2 diabetes, I'm probably, if I have depression, I might not get out of bed, which might be contributing to my type 2 diabetes, right? Like they're so comorbid in that way that it's a challenge that we have to weave mental health coverage into the mainstream so that it's treated, and the care that we provide is collaborative in nature.
Absolutely. Earlier, we were both kind of mentioning how the COVID-19 pandemic really changed not just mental health care, but really everything about how the world functions and how it operates. How would you say that the pandemic has influenced trends and accessibility to mental health services? And are there any lasting changes, do you think, in how mental health services are delivered or accessed as a result?
Yeah, I think like on the legislative slide, there's been a lot of talk, right? Like I think like the Biden-Harris there's a policy to increase federal funding. We've had like, I think it was the Parity Act. It's like 25 years old that like their insurance coverage should have parity on the mental health side from physical health. Made a big deal about it, but like it's never had any organization to implement the policy or ensure that there was compliance to it, right? So here we are. It's out there. We've talked about it. It's in the press. You'll see press releases, but in reality, nothing's. Payments haven't moved up. Coverage hasn't moved up in that capacity. The thing that I think has been a great thing that's changed is the government kind of loosened up rules on telehealth. And so that really like just shot off post-pandemic, right? So it shot off. We saw a rise in our world to 70-75% during the pandemic because it was the only option. And we started to realize we can, just like you and I we wouldn't have been doing this necessarily before the pandemic, but now we do this like a second, like without even flinching, right? And it's a normal expected way of having conversations like this. And telehealth is obviously sustained in mental health, in telepsych, teletherapy, outside of the rest of the disciplines of healthcare. That's settled at like a nice steady state. And I think that's helped with accessibility, right? So like there's a group called the PsyPact that's been formed. It's a organization of 40 states providing some level of reciprocity of licensing. So if I'm licensed in state A and I go like to the PsyPact organization, I get their licensure, I can provide care cross state, right? There's that kind of thing is the thing that's creating a lasting effect. So if I'm in that state of Wyoming and there isn't providers available to me locally or within a reasonable commute, I can start seeking care from a broader population of providers, right? That's a big transformative change, both in the technology, A, and then B, in the opening up a bit of access. It doubles and triples those other problems I mentioned earlier, right? Am I matching the right person? The right, all that just like gets bigger. My wait lists start getting, now it's like the whole world is coming in, right? Like, so there's a lot of compounding effects, but your question about were the lasting changes to access, I think that's a big one.
Absolutely.
Probably the biggest.
Probably the biggest. I completely agree with you. And you're even absolutely educating me. I didn't know about PsyPact because that is something that practitioners deal with, is being able to still access their patients who are telehealth that may have, let's say we go on vacation to, I'm in North Carolina. Let's say I go to, or my patient goes to Georgia. If I'm not licensed in Georgia, I cannot practice with that patient while they're there, even if they need like a momentary thing. So having things like PsyPact is pretty excellent in being able to provide care across the continuum, not just who is in the same state with you.
Yeah, 100%. And like, look, it also, the telehealth has been good in that, look, it's not just the state to state thing. It's also like in my state, if I have to drive 40 minutes to see the therapist who's in network and I have an hourly job and the only appointment that's available is at my lunch break, like, what do I do, right? Like now I can do something about that, right? Or if I'm a divorced family with a kid and I need to figure out schedules and I can't get that to work, like telehealth opens all these things up in a big way. Access to different family types, access to different economic types. It's not just, access to the supply in general.
Absolutely. And I appreciate that you bring up economics, because the reality is that I may not have the accessibility or the access to be able to drive my car 40 minutes to get to you.
Yeah.
But most people in America have a cell phone and some way to access Wi-Fi or, internet services somehow. And so being able to reach all people, not just those who would traditionally come inside from mental health services, is a great resource.
Totally. In a lot of those areas, believe it or not, they still don't have broadband, like rural areas still don't have broadband. So like being able to do it on a mobile device is crucial, right? Like you have to optimize the telehealth experience for mobile, not just a computer.
We'll be right back after word from our sponsor.
Continuing education is both a requirement and a learning opportunity, but finding the right CE provider can be challenging. AATBS, a triad company, offers continuing education for psychologists, social workers, marriage and family therapists, counselors, and behavior analysts. CE courses are available both individually and as part of our new All Access Pass. All Access Pass provides a library of over 250 unique courses. That's more than 800 hours of CEs, with new courses being added every month. As a special offer, Behavioral Health Today listeners can save 15% on CE purchases. Visit us at aatbs.com/BHT and enter promo code BHT15 during checkout. That's aatbs.com/BHT. Check out our library and check off your CE requirements today.
Absolutely. Absolutely. So bringing it back to what Valant does. So what role do you see the EHR softwares, like I mentioned, just like Valant, playing and integrating these technology advances to improve accessibility?
Yeah, we're right in the mix of this thing. I talked earlier about our matching algorithm, right? That we built for matching patients to providers. So crucial. I think we studied this problem and we lived in the market. We all talked to lots of customers. So we are solving problems that are on the street level, not in the headline level. Do you know what I mean? Like there's so many things that get talked about at the headline and they're just, that's all they are. Like they gather the eyeballs, they gather the attention. The real work, the real problems are on the street and we're in the street, like listening. So that's one you'll never hear anyone else talk a lot about, but it's core to how we built our software up front to our customers with a longer term goal of like linking that up into the sources of demand, right? So like think of the ZocDocs of the world or directly to membership. If I'm a member of Aetna, I want to be able to go to that member directory and find the provider and book the appointment right there, right? Like that, just being able to enable those things, take steps out. That's one. Telehealth is a big part of what we do as well. We have a telehealth platform that we built integrated into our workflow, right? So like as soon as you set an appointment up in our software, the appointment reminder is already built in with the telehealth link directly to the appointment. We have a virtual admin. So like before you get into the telehealth session, if you have a balance due or a copay due, like we allow you to pay that outside in our software. We're the bad guy. We're the virtual front desk person that says, hey, you need to update your insurance. You need to make this payment, or you were supposed to do this like updated PHQ-9. You haven't done it yet. Take it real quick now. Those sorts of things, right? Like getting the tasks that the front desk might have done, that's integrated into our software, right? So you're not just going to a Zoom, but the patient is going first into the virtual admin, getting all those things taken care of. And then they have a clean entrance into the telehealth room with their practitioner, right? The provider.
Nice.
Yeah, building that on a mobile device. Not just for, we have an app, right? So all that we're trying to do in an app base, because we understand not everyone has broadband access, right? You have to be able to do it inside of a mobile app as well. Probably some of the biggest things we've done.
Right. And I was actually going to ask you, so what makes Valant different? But you've already answered that question. Just being able, the matching itself is something that I don't know that I've seen on a lot of other software companies, or their availability to match people to what they need on both sides of that spectrum.
Yeah, because you're right. It is both. So like what people realize, like there are providers who have large wait lists and they don't want to just call down that wait list, right? You want to call the ones that you think have the highest likelihood of being a good fit on your side, right? Like you're going to call down a wait list. I'd say the last little thing we like to talk through in this equation, because we've been talking about the front of this care spectrum, if you will, in terms of access, is having like mental health specific eligibility checking on insurance, which that doesn't really, like most of the tools that are out there are really generic to healthcare, and they're a thumbs up, thumbs down. Do you have like, you just put in your Blue Cross Blue Shield member number and you'll come back and say they have coverage. It doesn't say whether you have mental health coverage. Do you have coverage for therapy, for psychiatry, for this diagnosis? And then what is the actual coverage? And so like me as a seeker, I don't really have a lot of information about what is going to get covered. And the tools that are out there right now aren't doing a great job of providing that insight. And so we have been working with some partners to build mental health specific, verification of benefits up front. So I can come back and say, yes, this person is covered, you're covered. This is how much is covered for, this particular diagnosis coded depression. And this is how much your deductible is left. So your next 3 sessions are probably going to be cash, and then you're going to start getting coverage, right? It's like that information, back to accessibility, knowledge, and the financial aspect of this being a barrier is also important to people to know, because most of us are on high deductible plans, right? Like you just got to know how much am I coming out of my pocket for the next few months as well.
Right. And again, as a seeker of services, that is something that I have not experienced. It generally has been. I really just looked a couple of weeks ago, got new insurance. And I'm like, oh, let me check and see what I can use, who is the right person for me. Let me look through this list. I put in mental health person near me. And they gave me some people, I will say that,
Yeah.
but it did not tell me what was covered, what diagnosis codes were covered there. They did not discuss whether the person would provide me with medication, if the medication would be provided, what my copay was. None of that stuff was there for me. So as a seeker, it was frustrating. Of course, as a practitioner, I kind of get it. And so I made the phone calls and I did the extra work for it.
Yeah.
But I think that is mainly because I understand the benefit of it. And I am, as a practitioner, in the middle of it. So I get that. But I don't know that the general layperson is going to want to go that far or even have the ability to do so.
And Sharlee, like, think about the fact that we're dealing with people dealing with depression and anxiety, right? Like, we're not dealing with my foot hurts. I'm going to go through this to get the person I need to take care of that acute problem. I have depression, I have anxiety. It's hard enough to get motivated to do some of these things.
Yes.
So when they're even more difficult to do, there's a higher probability you go back into one of those 54% that don't seek care, you know?
Absolutely. Absolutely. And I just, mine is mainly for self-care. So I can be like, oh, okay, well, I'll keep pushing. I'll keep trucking along.
Yeah.
But like you mentioned, if I did have a more severe issue, I don't know that I would be able to push through to ask them more questions, to put myself on 10 waiting lists just to see who may call me back and it might not work, that kind of thing. So, yeah.
It's tough.
So just in mentioning that about patient engagement, how do you see Valant's software enhancing engagement and then ensuring that patients are receiving the care that they need?
Yeah, I think, and this one is going to evolve because this is like, I'll throw the one, I don't like to use like the technology buzzwords out there, but everyone's talking about AI here, right? Like, these are areas AI could help, they could distract, they could be vapor, right? We don't know yet. But if I work my way back and talked about some of the problems that I think are worth trying to solve, I think that's a helpful way to say, where would we eventually over time potentially apply AI? If you think about patient engagement, we spent a lot of time talking about like engagement pre-patient, like how do I make sure I get the right patient provider matched up front? Once I have done that, we're big proponents of measurement-based care, right? Having some kind of objective evidence on the baseline and then the ongoing improvements over time. And it could be as simple as doing a PHQ-9 for depression, GAD-7 for anxiety. There are hundreds of scales out there that measure everything. Everybody's got their favorites. A lot of people have no favorites. 80% of the market does not use objective evidence to establish a baseline and demonstrate results, right? I think if we're going to engage with patients and give them the constant motivation and encouragement to stick with care, it's important to show them objective evidence that the care is improving. We do that in our technology. We try to do all that automatically, right? So when you set up a patient, we have like 80 plus scales that are pre-built in our product. Those scales can be attached to different diagnosis types and treatment types, and you can establish them as part of the treatment plan. And then when you send the intake paperwork out to the new patient, you can automatically add those scales. I'm just clicking check boxes all along the way on the assessment. We're automatically calculating that into a score that over time will chart and graph and can visually show you that the depression score is going down. I may be here week over week, month over month having therapy, wondering, is this making a difference? But if I can visually show you that your depression score is actually improving over time, that's really helpful, right? That's the sort of short-term core of our product, is automating all these work, understanding these routines, automating them, and helping enable that to happen. Lots of other ways we provide patient engagement through our mobile app and the appointment reminders and the ability to interact and directly message with your provider. But I think like having that objective evidence is so crucial. I think if we're going to get the attention of payers to pay us more over time in this industry, we have to show objective evidence, right? Like that we're making a difference. And then I think we'll get paid for it. There are, people don't know this, I'm going to throw this out for you, for your audience. If you use these measures, there is a procedure code 96127. I don't know if you've ever heard of that one or build against it, but each time you use a measure, you can put that as an add-on code and get somewhere between 2 to 5% more reimbursement per patient. So you could do 4 of those codes based on what you're assessing and get paid up to 20% more from your payer, just to incentivize you to measure the care, right? And so I think that's a big part of motor. Longer term, if I give you some direction or vision into the future, I think there's a potential. I don't know if in your clinical social work, you do treatment plans with your patients. or not, right? You build your treatment plan, you have your PGOIs, and you set them up at the app post intake, and you have your plan, right? And maybe one of them assigns a task to write up your values. Maybe you're doing a daily check-in on things you're grateful for. Yeah, that's stuff we think we can help enable in software instead of being worksheet, right? So you can see a time where in our app, you'll set the treatment plan, you'll pick all of the items. We just rebuilt our whole treatment plan software this year. It's world-class. We're really excited about it. But where it's going to go is when you assign, so you build some of these as the activities or tools, assignments inside of your treatment plan, they can turn into digital assignments. And so I can get a reminder in the app today to check in, like, right? What are you grateful for today? I put that in, right? Like if you're a substance use disorder patient feeling like the urge today to break, like I can document and record that, which is part of the process of journaling, right? I can get that out there, particularly in our app. If I asked you to do your values assignment, I can give you a reminder during the course of the week, maybe give you examples of what other people's, there's just ways I think to keep your clients engaged in between sessions. What's awesome about that is wait lists are growing. I think some of that can be applied to help keep people on the wait list engaged. So you put your name on like 8 wait lists. Well, what if one of them was kind of talking to you and keeping in touch with you digitally and assessing your need and collecting information afterwards? And I think the most important, Sharlee, is when you discharge the patient. Not that we do that like with ease of frequency, but when that happens and you discharge the patient, you assess them, you build a treatment plan. Let's say you measured the baseline and demonstrated outcomes from your treatment, and then you discharge them. They still need all those tools, right? You still want to do mindfulness kind of work. You still want to track what you're grateful every day. These are ongoing, lifelong tools. We think there's a way to hand them off with a tool set that's digital to keep engaged.
Okay. Got you. And that was going to be one of my questions. No, it makes complete sense. And that was going to be one of my questions, is that it seems like you are addressing the gaps that occur during the mental health service, but what happens when, let's say, I'm no longer necessarily a client? A worksheet allows me to flip back through my notebook or the notes that I've taken in session, and I can flip back and look at my paper and see what I wrote here and really, look at those changes. So being able to access those when not necessarily getting being involved in the service itself is very helpful.
Yeah, I think these are the sort of the pre, the during, and the post are breakthrough opportunities. Now, just like measurement-based care has been around a long time, we've had that in our system. There's only 20% adoption. So the uphill challenge is getting people to change the way they work, right? And I think long-term payers will pay us more if we change our behavior and can kind of agree to measure the care, agree for objective evidence. I think we can get paid more in this industry and do more at the end of the day.
I absolutely agree with you. But then on the other side, what do you say to people that are having a hard time using technology or going deeper into being able to use certain software systems? So I mentioned that I've left the school system and now I work with dialysis patients. And just based on what, the type of patient that I work with, they are a lot older and not necessarily very interested in digital things. So I try to give them apps that they can use for their phone. And they're just like, I don't know about this, Sharlee. I don't know about this. So what do you say to those that aren't necessarily ready to move where the rest of society may be moving?
I think we got to meet them wherever they're going to be, right? So I think there's no every answer or every market segment's going to have sort of unique needs. I mean, I could take if I'm a Spanish speaking population too, if it's all in English, that doesn't help either, right? There are lots of I think sub optimizations we have to make for the diversity of patients that we're treating. To your point earlier, having access to those tools, maybe sending them reminders in their email, because I think they tend to be more email oriented, and they may still live in Facebook. Let's not discount our seniors. They love Facebook and they're in their email. I know I might got 2 senior parents in their 80s, and there's a lot of things they can't do, but they can do those 2 things really well. I give forwards from my dad still to this day, reminding me of different ways I can eat. And anyway, I could take a whole tangent there, but I think that needs a different approach, if you will, than being totally app based. in that case. So I think we have to build and get some attachment in the segment, and then we have to expand out of there. Kids are going to work in a totally different way, right? Like than seniors, and then like each of your generations as well.
Absolutely. And don't knock Facebook. I love Facebook still. Don't knock it. Don't knock
I'm
it.
not knocking it. I'm just saying, my parents are really adept at Facebook.
So I like positivity. So can you share with me a success story or even a case study where Valent's EHR system has significantly improved access or accessibility for a practice?
Yeah. I think like we have a client who has been like at the forefront of this, right? Almost if you take everything I said and package it all up under one organization out there trying to do just this, increase accessibility. They're 100% telehealth practice, right? So all of their providers are distributed. They don't have a physical office. They're still behaving and acting like they are a physical. So this isn't like a direct to consumer model, right? It is still, intended to provide the same sort of care you would expect out of a physical brick and mortar location. But they've employed all of the techniques, right? They're digital first, they're telehealth first. They use the patient provider matching to make sure they have a good fit up front. And we're seeing them grow in leaps and bounds, right? It's really helping to scale their business because of the ability to use all of these tools to reach a broader audience, the right audience, and to provide objective evidence. They use all our measurement tools. They're even on the forefront of trying new kind of AI components as well on the intake side to really get ahead of the market. So that's a platform that sort of sits right in the square middle of this whole conversation we're having, trying to deliver care across this whole spectrum, which is exciting to see customers of ours using every square inch of what we put into the product,
Nice work. So then for mental health practices looking to improve their accessibility, what practical steps would you recommend that they take with their EHR systems? And really, how can they prepare now to meet any future challenges or opportunities?
Yeah, I think one of the hardest things to know is like when you say increase your accessibility, right? Like I think there are multiple challenges there. I said earlier, like the first is just availability, schedule availability. And I think so if you want to have like schedule optimization, scheduling is like an age-old problem. It's an industrial problem. It's an inventory capacity throughput kind of model, right? And so I think one of the efficiency challenges becomes when I get those patients that come in, I look full, they had one session, they never come back. That was a really sub-optimized calendar slot, right? Tuesday at 9 a.m., I had that 1 hour slot or 30-minute slot, and I filled it. I spent the time doing the intake. I plugged them into the spot, and they didn't come back again, right? You have no-shows somewhere in there too, but let's just pick this one. Having picked the right patient up front increases the probability that slot stays full over time, and I reflect the proper amount of availability that I really have over long term to my potential patients. And then on the flip side, I picked the right patients to fill those slots. And then I could give a better reflection for what I really have to offer. The second part is the harder part, right? Because I understand the economic challenges here, but if you're not taking insurance, you're by default, shutting out a big chunk of the market and you're not going to be accessible to them. At the very least, help them with your EHR providing the information and the super bill required to go easily submit for reimbursement. But so many people won't go through that. So, this is the harder one. Just to answer the question generically is to have more coverage. When you do, we are all about making that easy. We're going to give you in the matching criteria that verification of benefits, the eligibility checking that pairs the two. Like I said, we're working with partners to be very behavioral health, mental health specifically focused to increase that success rate there. And then making sure it's easy for you to get enrolled, get your new team enrolled, and going. Maybe the last littlest thing is go build a practice, find people that are like-minded and build scale. Because when you build scale, you're going to increase accessibility by default, right? You're going to be able to specialize. You're going to, and that's so much of the market is distributed and individually practiced that it's hard to find them. It's hard to get the match done, and it's hard to then kind of continue with care. But those are obviously the things you're doing. Take on telehealth, be open to that. Most people are today. I don't think there's a lot of pushback on telehealth. So use those services. A lot of new tools are going to come out. Like I said, the kind of inside the pre, the during, and the post patient experience. AI tools are going to come in. Some of them are going to be useful. Many of them are going to be distractions. We're going to pick a couple areas that really make a difference. And so I think those are, a bunch of the things that I think we should be looking for. You should be looking for out in the market from your providers. Are they going to help you along these ways with the matching criteria, with the eligibility checking, with the insurance and payer coverage, great integrated telehealth service? Are they going to be able to help me scale a business? So I have data and insights on how I'm performing. If I really do care about serving a certain market or segment, I need the reporting out of my EHR to tell me whether I'm accomplishing that goal or not. If I want to be able to see that all of my patients are coming from this particular zip code, or there are a diversity of zip codes, or if I'm looking to make sure there's diversity of insurance types, I need that baseline data before I can go market to that community, right? So you also need that reporting and data. That's crucial. So look for those factors from your partner.
Absolutely. Thank you. And so as we get ready to wrap up, Ram, what are your final thoughts or even any advice that you have for our listeners who are passionate about improving accessibility in mental health services?
Yeah, look, I almost rebound the exact same thing, build a plan. What does it mean to you? When I'm trying to increase accessibility, it means something different to everybody. I'm trying to reach an economic group. I'm trying to reach a neurodiverse, subsegment group of people to build awareness. I need to reach referral partners. I need to know how to connect to those. That's something we are going to do, is connect you to specifically referral partners in the market. And then make sure if you're picking technology, you're picking a partner that can help you with these things, understands these things, from the matching of the prospect to the verification of the benefit, to the eligibility checking, to the telehealth integration, the data and the reporting, so I know how I'm performing and doing long-term, and the ability to help you scale and grow a practice to reach that underserved population that you're trying to hit to increase accessibility, and to be as efficient as you can with the time slots that you have available to offer the market.
Absolutely. Thank you for that. And so as we wrap up, where can listeners learn more about Valant EHR software and the solutions for enhancing accessibility to mental health care? Where can folks learn more about you?
Yeah, come visit us at valant.io. That's VALANT.io. And we're excited to talk to you. This is what we do. We're not in the rest of healthcare. We are in mental health. We're not in physical health. We live and breathe this. We're founded by psychiatrists. We're measurement focused. We live here and we're passionate about it. We built a great team that wakes up every day trying to make the world a mentally healthier place.
Awesome. Thank you for that. Ram, thank you so much. I really appreciated speaking with you today.
Likewise. It's great to talk to you. Hope we do it again.
Absolutely. I'm looking forward to it. And thank you to our listeners for taking the time to join us. The resources for this episode and an archive of all of our other episodes can be found on our webpage at triadhq.com/BHT. And we look forward to having you back with us next time on Behavioral Health Today.
We appreciate all the support from our community, and if you like our show, one of the best ways you can support it is by giving us a 5-star rating and leaving a review. Behavioral Health Today is a podcast part of the Triad Behavioral Health Network, all rights reserved.